So, dear students, today I'm going to discuss about the topic that is on helminthic infections. Here, uh, I'm going to discuss about only two worms. One is roundworm, and another one is hookworms. But I will focus on the two different type of worms that mostly infect the human. So only the human infected roundworms and the human infected hookworms will be discussed today. One example from both the groups. So first I will start with the roundworms. So if you look into the general morphology of the roundworms, you will see that the common name of the class, that is uh, Nemathelminthes, that is known as the nematodes. And in this common class, they are, the parasite is known as roundworms. So one of the parasite that falls in this particular class is Ascaris. So most of the roundworms, they differ in their size from few millimeter to several centimeter. The examples of roundworms fall in this millimeter range is Enterobius, and in centimeter range, that is Ascaris, to be discussed today in detail. So most of the cases, the ascaroids, which are the roundworms of the small intestine of many animals, including humans, they are characterized by their large size, three prominent anterior lips, and the absence of bursa, that is copulatory bursa. These roundworms have simple direct life cycles involving fecal oral transmission of infective eggs. And female worms that produce numerous eggs, which are excreted with host feces and must undergo embryonation before becoming infected. So, as I said, that the shapes they are elongated or cylindrical in shapes, and their body is unsegmented. So the sex is separated, so they are bisexual. Both males and females are seen, and generally the females are larger than the male in size, and you can identify the male because they consist of copulatory bursa at the posterior end. The second one is that the male that have the reproductive organs, and the reproductive organs are testes, seminal vesicles, copulatory bursa, and the spicules. So, copulatory bursa is a sac a sac-like structure that receives the sperm during copulation in this particular parasite. And the spicules, that is also a part of the reproductive organ of the male adult roundworm. So they are minute sub-pointed object here. You can see minute sub-pointed object, or the structures that are typically present in large numbers in the male part of the adult roundworms. The female reproductive organs, they contains ovary, they contain oviduct, uterus, and the vulvar opening. So these are the parts of the female reproductive organs of roundworms. And these roundworms, they have longitudinal as well as transverse massive fibers. And the body is covered with the cuticle layers. So this cuticle layer is only functioning here as a water impervious protective layer that covering the epithelial cells, the total organism, and limiting water loss from the organism. They have an excretory system, and this excretory system is the longitudinal canal. They have an alimentary canal. So this is their anterior part, this is the posterior part, and this part is their alimentary canal. So alimentary canal starts from the anterior part, so from the head, and it provides the buccal cavity. This is the buccal cavity. So they have lips, teeth-like structures, lancet and glands that are present in the buccal cavity. And different type of esophagus. Here you can see different type of esophagus: club shape, cylindrical, rhabditiform, double bud, or cellular type of esophagus they have. And also they have a nervous system which is functioning as esophageal ganglion. So this is all about the general morphology of roundworms. Now I'm talking about the Ascaris lumbricoides, taking as an example of roundworms. So Ascaris lumbricoides is the first representative and the most common intestinal parasite of human. And this particular parasite is widely distributed among the world as well as the urban areas, among adults as well as children. So mostly the the parasite it is widely found in the tropical as well as the subtropical region countries. And these parasites, they have a particular typical morphology. And the adult forms of this Ascaris lumbricoides, both males and females, we have already discussed. But if we look into their developmental stage, so they have three stages: eggs, larva, and the fourth stage, that is the third stage, that is the adult stage. So in this larva stage, they maintain three different forms: L1 to L4 forms. So the fertilized eggs, it appears as round or oval structures having the sizes near about 45 to 75 micrometer long and 35 to 50 micrometer wide. They are surrounded by a thick, here you can see that they are surrounded by a thick albuminous layer. And this albuminous mammillated lumpy outer coat is preventing them to stay there at the small intestine. So next is that the epidemiology of the particular parasite. So this particular parasite is, as I said, this is widely distributed throughout the temperate as well as the tropical areas. And 40% of the population in Africa and Asia, they are infected by this particular parasite. And in China, you can see that near about 6 crore people they get infected in 1992. So this is the morphology, and from this picture you can see this is the male and this is the female, because the females are the more stout, larger in size rather than the males, and they pretty much look like the earthworms. And the females, they are about they have the length of 20 to 35 centimeter, whereas the males, they have a length of 12 to 30 centimeter. So they contain three lips which carry the minute teeth-like structure. And this is all about the eggs. So there are two types of eggs: fertilized and unfertilized eggs. So mostly from the stool, the unfertilized eggs are coming to the earth and mixing with the soil, and then they are converting into fertilized egg. The egg contains a ovum part at the core ovum part. Then there is egg cell, and apart from that, they have a albuminous layer, that is the extra protection or the external covering of over the egg cell. So mode of transmission, most of the cases we have seen that mode of transmission is oral fecal origin. So Ascaris lumbricoides, they prefer, or most common is a human population, and this is their normal habitat or normal host range, particularly in tropical and subtropical countries with high rainfall as well as temperature region with warm summers. And infections are particularly prevalent in countries where night soils, that is the human feces, is used to fertilize vegetable crops. It is estimated that almost 1/4 of the world's population may be infected. And infections are over dispersed in local population where large number of parasites occur in a small number of individuals. Children are the most susceptible to clinical infections, although a range of polydisposition factors have been reported involving various combinations of environmental, social, behavioral, and genetic factors. A similar species sorry, some occurs in pigs, especially in developing countries with free-ranging villages. And modern husbandry practice in developed countries have resulted in a significant decline in the incidence of infections in pigs. So the site of infection in in the case of adult worms that lives in the lumen of the small intestine of human, where the female adult ascaris will lay numerous eggs, near about 2.5 lakh eggs per day, which are set in the post feces, coming out through the post feces. Now I'm coming here to the life cycle of Ascaris nobiquidus. So here you're seeing that the adult worm that live in the lumen, that live here, the adult worm that live in the lumen of the small intestine of human, and the female may produce up to 2.5 lakh eggs per day, which are passed through the feces, and the fertilized egg embryonate and become inactive after 18 days to several weeks, depending on the environmental conditions. And they prefer the optimums, they prefer the conditions, that is the optimum conditions for this particular parasite is a moist one, warm, and the shaded soil. And the soil must be clay in nature. So these are the four parameters of the environment they prefer, which is their optimum environment for their growth, the development stage. So after infected eggs are swallowed, the larvae hatch and invade the intestinal mucosa and are carried via the portal and then systemic circulation to the lungs through the heart. So the larva mature further in the lungs. It will take 10 to 14 days, near about 2 weeks, and penetrate the alveolar walls, ascend the bronchial tree to the throat, and are swallowed. So upon reaching the small intestine, they develop into adult worms. Between 2 to 3 months are required from ingestion of the infected eggs to uh, oviposition by the adult female. And here you have seen that that they after infecting the human, it can develop several symptoms. And what are the symptoms? The symptoms are after the larva has invaded the lungs, they may develop pneumonitis. So it is a general term that is referred to inflammation in the lung tissues, mostly prevalent in case of infections of bacterial infections, but here in Ascaris infection may also develop pneumonitis. And after that, there is the development of asthma, means short breathing. Then another disease, that is Loeffler syndrome. This is a kind of disease in which the eosinophil accumulate into the lungs in response to the parasitic infections, and the parasite can be strongly cited by then there are different types of parasites. That may be Ascaris, this may be Tyrophilaria, which can enter the body through contact with the soil and can develop this type of syndrome. Next one is what is the adult parasite is actually doing after entering into the host. So it has been observed that after infection of the parasite, when the parasite is staying at the small intestine, mostly the lumen part of the small intestine, the person or the individual is not showing any symptoms. So 80% of cases they are asymptomatic. And most common symptoms that are coming after infection, that is abdominal cramp or abdominal pain. And when large number of worms is produced, then the person will, uh, will be under malnutrition. And then when there is migration of the worms, and this migration of the worms can cause the symptoms like perforation, peritonitis, appendicitis, or extrahepatic biliary obstructions. So, in case of peritonitis, it is an inflammation of the peritoneum, and the tissues that line the inner wall of the abdomen and covers and supports most of the abdominal organs. So peritonitis is usually caused by the infection of different type of viruses as well as fungi, but infection of Ascaris is one of the cause of peritonitis. Next one is extra hepatic biliary tract obstruction. So it is the blockage of the normal flow of bile from the liver to the intestinal tract. So most common cause of EHBO include pancreatic disease, stone formation within the biliary system, gallstone formation. So these are very much common symptoms in case of the infection of the adult ascaris. Now, how to diagnosis? So different diagnosis process has been performed for the diagnosis of ascaris. But established infections are diagnosed by microscopic detection of eggs in fecal matter, often using sedimentation or flotation concentration technique. So flotation uh, concentration techniques, there we have to use a sufficient amount of feces. Stool sample should be mixed with normal saline, then it will be centrifuged, and then the processed stool can be checked under means from the processed stool we can go for wet mounting, and under the microscope you can check whether the eggs of ascaris is present or not. And macroscopic identification can also possible in case of adult ascaris. So adult ascaris can also pass through the stool, and they can be measured by a normal naked eye because they are in centimeter size range. Next one is prevention and treatment. So various anti-helminthic drugs has proven effective for treatment of these infections. Mebendazole appears to be the drug of choice, although it sometimes may cause some worms to wander. Then suitable alternatives include parental and and levomisole may also be used along with albendazole and levamisole. So most of the cases, these three drugs are effective, but when not, then we have to supplement it. So once diagnosed, infection can be successfully treated, but the individual often returns to the heavily contaminated environment and quickly become reinfected. So environmental decontamination is difficult because the eggs are very resistant to chemicals. They can embryonate in dilute formalin, also in potassium dichromate, in acid solution, and in many commercial disinfectants they can embryonate. Means they are resistant to this chemical treatment. Because the infection accumulates in their host, so worms do not multiply in host. Control measures involve avoiding behavior as conducive to the uptake of eggs, such as improving personal hygiene, maintaining sanitary conditions, and proper disposal of excreta. Then fresh fecal material should not be used as a fertilizer for to fertilize the edible crops, but it can be processed by microbial composting before using it. Or else you can use high temperature to destroy the egg viability. And at last, health education. This is very must. You have to educate the people who are living in these underdeveloped countries. So health hygiene is the key parameter here. So if you improve your hygiene, definitely there is a less chance of getting contamination of parasite. Next part, I'm coming to the parasite, that is a bookworm. So it's a different type of worm, and the causative agent is Ankylostoma duodenale. There are three types of causative agent that has been discussed and so far discovered. So human hookworm disease is a common helminthic infection that is predominantly caused by the nematode parasite. And here we have identified three parasites: Ankylostoma duodenale, Ankylostoma salinicum, and then Nicator americanus. Classically, the first I mean 1 and 3 means Ankylostoma duodenale and M. americanus. So they were considered the two primary intestinal hookworm species worldwide, but newer studies have shown that a parasite infecting in animals, that is Ankylostoma salinicum. So this particular parasite is actually growing as an emerging parasite that infecting human in some regions. So here we have to consider these three parasites. But today I'm going to discuss about the about Ankylostoma duodenale. So first we will start with the morphology of Ankylostoma duodenale, and here they apparently they look like grayish white or pinkish in structure, but when they are coming from a freshly passed stool, and if you have studied it, you will look like, it means this parasite, adult parasite will look like reddish in color, only because they have ingested in their intestine, they have ingested blood, RBC. So due to presence of this ingested blood or RBC in their intestine, they look reddish in color. The adult parasites, they have two ends, anterior and posterior end. The anterior end is slightly bent in relation to the body, and it's a hook-like appearance. That is why they are termed as hookworm. They possess a well-developed mouth with two pairs of teeth or three pairs of teeth. And the males are shorter than the female, and the females are often longer in their size, as well as they are stouter or healthy looking. Males can be distinguished from the female based on the presence of their prominent posterior copulatory bursa that was absent in Ascaris male. But the oral aperture is not terminal but directed dorsally, and the buccal capsule contains three pair of teeth, four hooks, and two knob-like plates on the dorsal surface. And here this picture is showing the buccal cavity. So here you will check the teeth, and this is the pharynx that will start from the buccal cavity. Now there are five different glands that are connected to the digestive system and secretes a liquid which prevents the clotting of blood in the host. Now I'm coming to the mode of transmission. Here, the infective mode is the filariform larva. So if you look into their life cycle, so you will see that the eggs are passed through the stool of the infected human, undergo if that comes into the favorable conditions, means moisture, warmth, and scent, as well as the clay soil, then the larva hatch within 1 or 2 days and become free living in contaminated soil. So this released form larva, which is known as the rhabditiform larva, grow in the feces and or the soil. So here in this picture you will see very clearly their life form. So this is the rhabditiform larva that is coming after the hatching of the eggs, that is coming through the feces and getting the favorable conditions. So these infected larvae can survive 3 to 4 weeks in favorable environment, and on contact with the human host. So first the rhabdiform larva will convert into the filiform larva, and they are the free living parasite. So they can stay 3 to 4 weeks, maybe months, and then when they come in contact with human host, typically the bare feet, the larvae penetrate the skin and are carried through the blood vessels to the heart and then to the lungs. Then they penetrate into the pulmonary alveoli, ascends the bronchial tree to the pharynx, and are swallowed. Then, so when they are swallowed, then the larva will reach the jejunum part of the small intestine. They are actually staying at the distal jejunum or distal intestine part. where they reside and they mature into adults, and they are staying at the lumen part of the small intestine, typically the distal jejunum part, and they will attach or adhere at the intestinal wall and then the individual will feel blood loss. In multiple locations, the adult worms they are harboring, and also they are sucking blood from the human individual. And here, this form of the parasite, they can stay within the host from 1 to 2 years, maybe several years. They can stay there. So here you can see that the common site of skin penetration, how they penetrate. Mostly they penetrate to the toes. In the dorsum, that is the midfoot region of the feet, and among the gardener, they can enter through the hands also. So the hands are also the route of entry of that particular parasite. And this is the different forms of the parasite, how they are actually hatching from eggs to different forms of the larva. So this is the rhabdiform, and this is the filiform larva. And this is the most infected form of larva. This is actually infecting the host through the barefoot or maybe through the skin of the hand. And now coming, and then there is invasion. They are invasive type. They are coming to the heart, and then passing to from the through the heart. They are coming to the lungs and infecting the alveoli as well as the bronchus. And when they are coming to the trachea, the pharynx, then this is the esophagus and the pharynx. Then they will be swallowed, and they will come to the small intestine when they are swallowed. So in this way, their full life cycle will be completed. So most of the cases we have seen that this larva, they will create some pathogenic effect, some symptoms. So what are the first symptoms? The first symptoms is that some skin lesions. So ankylostoma duodenale will cause some skin lesions, and mostly these lesions are itchy. So within 1 or 2 weeks of the infection of ankylostoma, they will develop some lesions. So creeping eruption is a typical type of lesions. So it is a reddish type or itchy papular skin lesions produced by the aimless movement of the filiform larva. You will feel some sensation that something is moving, and they are moving into subcutaneous tissues for several months or years. And this particular larva is called, that is why it is called larva migrans, which is common in Ascaris braziliensis and Ascaris caninum. So which can not penetrate sternum and cannot reach the blood vessels, but they are staying there. So this particular reaction is known as cryptic reaction. But those who are of the invasive type, means Ascaris lumbricoides, they will create infection or lesions in lungs. So bronchitis as well as bronchopneumonia may occur along with high eosinophilia, where the larva penetrate pulmonary vessels wall to enter into the alveolar space. So what are the pathogenic effects we have seen in case of the adult worms? Here the microcytic hypochronic anemia is the normal phenomenon in case of chronic blood loss. And here there is a statistics that the healthy adult parasite is sucking 0.03 to 0.2 ml blood per day from different locations, mostly from the small intestine. So chronic blood loss from multiple biting sites is a normal phenomenon. And pressure effect of the binding sites can also be observed. So anemia is one particular type of symptom. The second one is a nutritional deficiency due to infection of this particular parasite. And what are the nutrient deficient we can observe? One is a iron deficiency due to ingestion of the RBCs, then folate deficiency and vitamin B12 deficiency, or maybe a cumulative deficiency can be observed in case of the infected person. Now, how to diagnose this particular parasite? So there are two different type of process. One is the direct method, another one is the indirect method. In case of direct method, first we have to check the individual stool sample. Both the microscopic and macroscopic examination is possible. So if the stool contains the adult form, then macroscopic examination is sufficient. But if not, so we have to look for the eggs, presence of eggs, hookworm eggs, and for that purpose we have to stain the stool. Iodine staining can also be used. Can be used for microscopic observation or examination of the stool. The next one is second type, that is the indirect method. In indirect method, examination of blood that shows features of microcytic hypochromic anemia and also eosinophilia. And the second one is that occult blood test. That if the stool is occult blood positive, then definitely you can say that the person may be infected with parasite. Now, what is the treatment of hookworms? So, treatment of hookworms is done by normal anti-helminthic drugs like thiobendazole, pyrental, tamoate. These are the drugs to be used for the treatment of hookworm. But in some doses, and other drugs are albendazole or mebendazole can be used twice or thrice per day. And secondarily, we have to treatment. We have to treat the individual for anemia also. A specific antihelminthic should not be started if hemoglobin is below 30%. So in such case, first anemia should be treated, and then specific antihelminthic drug should be administered when the hemoglobin is above than 50%. So here, ferrous sulfate supplemented with folic acid and vitamin B12 would be administered to the infected person. Next, I'm coming to the precaution part. So precaution should be taken because this particular disease can be prevented if you maintain health and hygiene. So proper and complete treatment of carrier as well as the diseased person should be followed, but prevention of soil contamination by proper sewerage disposal, disinfection of stool and soil should be done. And then you have to wear these persons who are working in the field. We are who are persons working in sewage disposal system. They must wear boot as well as hand gloves. So that may prevent this particular from the particular disease. So this slide tells you the differences between the two type of hookworms, Ankylostomus and Americanus. So here there are difference in their size. First, the original is larger, 720 micron. Then Americanus is 660 micron in size. They have cuticles, in transverse striations are observed here, bare prominent transverse striations. Then buccal capsule is very much shorter in case of duodenal, but larger in case of Americanus. In esophagus is absent here, but present here in Americanus. So these are the differences between the two type of hookworms. That's all